I'm Tony Sklar with bnetTV. We are here at the mHealth Summit in Washington, D.C. for 2012. I am speaking with AT&T's Ms. Geeta Nayyar. How are you today?
I'm doing great, doing great.
You have the most important position in AT&T.
Oh, I wouldn't say that.
I would say it's pretty close to it. Chief Medical Information Officer is the person who is changing the world one cell phone at a time.
I appreciate that. You know, we think the work that we're doing is definitely impactful and meaningful, and I'm very privileged to be part of that work.
So tell me a little bit about what AT&T is doing as a carrier in this particular space.
Sure, happy to. So, you know, at a high level, again, AT&T being who AT&T is and healthcare going where healthcare is, we really think that we can make an impact on healthcare. If you think about the old paradigm of how doctors used to make house calls with that big black bag and, you know, go to the patient's house and sort of assess what's going on, we're saying let's turn the big black bag into a smartphone, into a smart tablet. Let's meet the patient in their home, let's meet them in their place of work, and let's deliver healthcare in a better, more efficient way.
That's a pretty good mantra to have. It's a pretty bold statement. I would have been inclined to back that up with a lot more fact last year than I am this year. Speaking to all the people that I've spoken to so far at this show, seeing all the innovation that I've seen out there on the exhibit floor, I can understand a little bit more about how it can come to fruition at a faster pace. What are the hurdles and challenges that still exist, and what is AT&T doing to help get over them?
Sure. So, you know, I think the biggest hurdle are very similar to a paper-based system. So what you have in today's healthcare environment, as you well know, are different silos. You have different, you know, patient A doesn't talk to doctor A, doesn't talk to doctor B, and you've got all these paper-based silos. If this doc saw this patient and that patient, and no one's really sharing. And the bottom line, or the value proposition we're bringing to the market is saying, look, apps, mobile developers, come together, work together, let's find the solutions together, and let's connect that information and not now make mobile silos, but instead connect that information, work with payers, providers, all of the stakeholders in the industry to actually make that data meaningful and connect it in a way that hasn't been in existence ever in healthcare.
Do the carriers inevitably become a part of the ecosystem there where they're considered a provider of healthcare services, or are they still just, we're moving data?
You know, again, I can only comment on what we're doing at AT&T, and you know, we just have to say that we are an enabler. I think all of the technology vendors that are out here today or elsewhere, we are not, you know, we are not in the business of practicing medicine. I am as a physician.
You're a physician, right? Fair enough.
But you know, AT&T is not opening a hospital by any means. But we believe in enabling hospitals, enabling payers, enabling doctors and patients to experience and have better health care. So I think it's more the enablement component, if that makes sense.
So you bring up a really good point about you being a physician. Okay, so here you are, you're a physician, and now you've gone over to a carrier to help implement a program. What were some of those driving factors and forces that made you want to do that?
Sure. So first of all,
and don't say the money.
No, not at all. No, not at all. So actually, I'm still a practicing physician. I haven't left practice.
Okay.
So, you know, being a physician is very much a part of my identity and very much the reason that I came to AT&T. In my own practice, in my own experience with patients, and in working with other specialists and trying to coordinate care, became really frustrated with the system and said, gosh, you know, every time I talk to an IT person, a hospital administrator, a policymaker, they don't get it. They don't get what it's like on the front lines of healthcare. They don't get why my patients are frustrated or why I'm frustrated. And so as I thought about where I wanted to go in my career, and I thought about where I can make an impact, it made sense to go to an innovative technology player such as an AT&T. I did an MBA as well in my career, and I helped with the electronic medical record implementation at George Washington University.
Fantastic.
Because it made sense, because they needed a doc that said, look, you know, this is the technology, these are the patients, and how do we make them work together? And that's exactly what I'm doing at AT&T.
So let's talk about some of the experiences that you've had at Washington University in transitioning them into digital medical records. How long ago was that, and was that the first step into mobilizing healthcare for you and inevitably a portion of the ecosystem?
Absolutely. You know, for me, again, as a physician in full-time clinical practice, I was simply frustrated with daily practice, stuck in the office at late hours, trying to communicate with patients and getting their voicemail, not able to text them, not able to email them, and so on and so forth. And so when the EMR was rolled out at our practice, I sort of had this aha moment, maybe because I also had a business background, where I said, gosh, this could improve communication, efficiency, quality, and really became a champion within our department to make that implementation happen. And then as I thought about how many patients I could possibly see as a doc, right? How many one-on-one encounters could really make an impact in healthcare? I thought, I have more to offer as a physician who works in a big entity that's scalable, that's able to make an impact in healthcare in a very real way. And that's, again, why I came to AT&T and why I still practice, because I think it's very relevant.
You're not losing the aspect of it
Exactly.
either, which is, I think, is a really good balance.
Exactly.
Steve Barry and I had a conversation yesterday. Steve Barry is the head of the CCA, the Connected Carriers Association. We talked about the one of their programs and initiatives that they have enacted for 2013 is to work with nursing schools to create a mobile situation where a singular nurse in a home health care arena can visit 16,000 or attend to 16,000 patients per year. That's an astronomical number that can only be done with the help of the carriers, clearly, because of the ability to access the data through the system. And that is going to be a difficult challenge, and AT&T is a part of that, and I'm looking for your comments on that, or
Sure.
that type of a structure.
Sure. You know, the bottom line right now is that the typical office visit is 8 minutes. In 8 minutes, for my average patient, I've got to talk about their arthritis, their diabetes, their hypertension, and oh, by the way, how are you eating, how are you feeling, and what changes do I want to make to your treatment regimen? I just took about 30 seconds, 40 seconds.
Sounds about right.
And you haven't even spoken, right?
No.
My patient hasn't even told me what's on their mind, which is very important in any office visit. And so I think the only way you can see the volume of patients that you're talking about and deliver quality health care is by using innovative technologies that, again, just like I said, bring that black bag that doctors used to do and go to the house of the patient and really say, look, we've got more than 8 minutes. Let's talk in the comfort of your own home. Let's talk in the comfort of your environment. Tell me why diabetes is so hard for you. Tell me, do you not have a treadmill in your house? Do you not, walk your dog? I mean, all of the things that you don't really think about in an 8-minute office visit where a patient is outside of their environment. And now by extending that point of care for both the patient and the doctor, you're able to have a more personal conversation. You're not under so many time pressures as you were previously, and you're really able to personalize the experience of healthcare in a way that just doesn't exist today. There's only so much you can get out of an 8-minute office visit on both the patient side as well as the provider
Absolutely.
side.
And the patient doesn't want to feel rushed.
And neither does the doctor.
It's a machine. Get them in, get them out.
Absolutely.
It's all about turnover.
And the patients that I've known for years, the patients where I've known their families, the more I know about that person, the better doctor I can be and the better healthcare I can deliver. And I'm only as good as the data that I get. And in 8 minutes, it doesn't matter what kind of doctor you are, the reality is there's only so much that can be processed and delivered and given in that time. And so when you look to remote patient monitoring, when you look to mobile health, when you look at what AT&T is doing, we're saying it doesn't have to be an 8-minute visit, and it doesn't have to be done within the confines of the 4 office walls that exist in your office or your hospital or your ER.
So Geeta, this brings me to my final point. Give me the top 3 initiatives that we should be looking for from AT&T in your department within 2013.
Sure. Our focus, again, is really on clinical integration, bringing all of the stakeholders together, collaborating with developers, collaborating with payers, providers. We are looking to the cloud to continue to be where the industry goes. We are looking to data and data analytics to be where the quality comes from and the outcomes come from. And again, we're looking at collaborating. We are not in this to do it all alone. We understand that we need the right partners, the right stakeholders, and we are very much coming at this with a team effort.
That was more than 3, but okay.
I knew you'd give me a couple more.
I think that's really great work at AT&T, and thank you very much for taking the opportunity to speak with us. And again, congratulations to you and your husband on your baby.
Thank you.
I really appreciate that. I've been speaking with Dr. Geeta Nayyar from AT&T here at the mHealth Summit in Washington, D.C. for 2012. I'm Tony Sklar with bnetTV.